We have heard, unfortunately, this morning that Surrey Heartlands Health and Care Partnership can't be with us this morning. So what we're going to do is in order to make sure that you get a flavour of, and Ruth will put the brochure pages in the chat, but we've taken the opportunity to go back and look at the submission that they made, and I'd just like to give you a quick flavour of some of the things that came out, some of the sort of headlines that came out in their submission. So just introducing who Surrey Heartlands is. It's a partnership of health and care organisations working together with staff, patients, their carers, families and members of the public to transform local services and support people to live healthier lives. They're known as an integrated care system, partnerships where health organisations, local authorities and others take collective responsibility for improving the health of the local population. Surrey Heartlands covers the majority of Surrey and East Surrey, Surrey Downs, North West Surrey, Guildford and Waverley. But the partnership also encompasses all of the local NHS organisations and the Surrey County Council. So you can see it's quite a wide organisation. Summary of their project was, and there was some interesting information here, based on evidence from UNICEF, the first 1,000 days of life, the time spanning conception until children are roughly 2 years old, is a unique period of opportunity where the foundations of health, growth and brain development are determined. This development is influenced by a wide range of factors such as the parents' physical health and mental well-being, child nutrition, early childhood experiences, the child's environment and the relationship with family and caregivers. So the strategy development project aimed to commit to focusing on those first 1,000 days by creating a strategy that would shape how services would be delivered for the next 5 years. The view was to give every child in Surrey the best start in life, and the purpose of the strategy document was to provide a vision for the first 1,000 days transformation programme that families and professionals could convene around. It required partnership working across all sectors, and as you can see, Surrey Heartlands is very strong on that element. Just on the rationale, knowing from child development and economics research that the pregnancy and first 2 years is so important. To exemplify this, a child's development measured at age 22 months is an accurate predictor of educational attainment at 26 years old, showing the influence that early years can have on later life outcomes. And it creates a critical window of opportunity for health and social care services to improve outcomes for all children and close the gap between those with the best and the worst outcomes. I found that quite a striking piece of information. So they wanted to have impact across the whole of Surrey's families, and recognising that not every child has the same opportunities, needing to go further for those families who are at vulnerable or at risk of health inequalities. So starting off by aiming to understand the needs of the easy to ignore communities with protected characteristics, often referred to as the harder to reach groups, as well as the needs of the majority of the Surrey population. So the strategy outlines insight from families and professionals, so bringing both sides into it, and how we'll act on this to improve outcomes for every child. The strategy also recognises that some families may need extra support, but this doesn't always have to come from the NHS or Surrey County Council. Enabling families to make connections and gain support from other families, or enabling them to gain access community groups, will help avoid duplication, optimise existing resources, and most importantly, improve experiences and outcome for families. And again, found this particularly striking about this submission, that it's looking beyond just what we would normally view as the healthcare system and looking at the whole and the wider system. So the engagement and insight collection didn't focus just on one service such as maternity or a theme such as mental health. It was understanding the family's holistic experience of the first 1,000 days. So that was the basis of the planning for this particular project. Impact and results achieved. So the Surrey Health and Wellbeing Strategy was published in 2020, and it identified 3 interconnecting priorities to improve outcomes across the county, one of which was starting well. This priority entails forming a good understanding of the needs of the children and families in Surrey, which the strategy significantly contributed to. Goes on to say that, especially in the light of COVID-19 crisis and significant subsequent changes to the pregnancy and birthing experience, the day-to-day life of families and the amount of pressure and uncertainty they face, the strategy development has helped to accurately frame the specific priorities of Surrey's families. Having successfully created the strategy using insight from families and the workforce, the First 1,000 Days programme can be confident it meets the requirements of Surrey's families, and also it fully acknowledges and addresses health inequalities, vulnerable families and families who have children with additional needs, for instance, SEND. The insights have enabled the First 1,000 Days programme to allocate dedicated resources towards 5 work streams. So they've identified 5 work streams as a result of this, that reflect the needs of Surrey's families and workforce. And the project goes on to comment that without this insight, there is the risk that projects and transformation plans do not truly address the needs of Surrey's families. So clearly there was a lot of work went in within the project to understand the wider implications of the health care and the needs of families in order to bring things back together and have an influence within the healthcare background. One other thing that really particularly struck me, and talking about relevance to other groups, but there's a phrase in here that I think we all would resonate with, and perhaps ought to think about more if we're not already aware of it. So a Surrey Health and Care Partnership works with partner organisations from healthcare, social care and third sector backgrounds. The results of the research revealed a great amount of the changing needs and wants of the Surrey population. The research enabled our programme to look at a family's holistic experience of their first 1,000 days, not just of their experience of a particular service or theme. Families are the only people that experience the system, and this is an interesting area, whereas services can take a more siloed view. This research has enabled services to think about the system and how we can work more collaboratively, I'll try that again, as a collection of partners to make the journey easier for families. Systems thinking is this idea, and actually this is a crossover from lean management thinking, and I know that is becoming more and more embedded in healthcare, and it's really thinking about the whole system, from the macro right at the top, which is, you know, maybe the head organization, and then going right down into the detail more and more, so that you see the whole picture. And if I'd had time, I would have shared with you a wonderful a cartoon that we have, which is of people looking at an elephant with blindfolds on, and because they can't see the whole picture, they're calling it all kinds of creatures. But taking those blindfolds off and looking at the whole picture, the whole system, you get to see a different view. So the findings have been shared with a wide range of partner organisations with the view that this will promote more multi-agency working. And I'd just like to leave you with 3 key learning points that were highlighted by Surrey Heartlands from this project. The first is to take a holistic view of a patient's experience. So patients experience the system of support. So it's important not to engage with the siloed mentality. I love this. Ruth's given me a 1-minute warning. Collaboration between the workforce and local people can improve the experience of services and the financial sustainability of the system. That's also close to my heart in terms of learning and understanding, you know, the financial implications of the things that we do and how that can really influence things going forward. And finally, it's important that engagement is meaningful. It's the only way to ensure citizen and workforce engagement are built into a business as usual for service transformation.